Federal, state, and local leaders came together in Washington County to discuss the opioid crisis.
Because we've for too long tried to address this issue maybe as a law enforcement issue or a public health issue. It's all of those different things, but we can't work siloed and apart. We have to connect and come together.
The message was clear: to get rid of the stigma and shame that is brought on to those who may suffer from the addiction and provide help.
You know, there is this whole attitude of shame. There is. And that needs to change. And until that changes and people actually want to be educated and want to believe and accept that there is an issue, it's not going to change.
Even though 24 people die every month from prescription opioid overdoses in Utah, the statistics look promising. From 2013 to 2015, Utah ranked 7th highest in the nation for drug overdose deaths. But as access becomes less, those numbers are going down.
All drug-related deaths in Utah down 12%, opiate down 16%, heroin first decline in 6 years at 14.5%.
The highest deaths were observed in ages 45 to 54, both males and females. In Washington County, however, those numbers have risen above the state and national levels. Intermountain Healthcare has vowed to reduce the number of opioid prescriptions their doctors give out.
By the end of the year, reduce opioid prescriptions by 40%. We're well on our way towards achieving that goal.
Retired St. George physician Craig Booth said access to the medications and Big Pharma have caused the problem.
And now you see major lawsuits against those pharmacy companies for pushing the medication. As a result, we're now seeing our doctors begin to cut back on the numbers of patients and the number of pills being prescribed.
I want to protect the doctors that are doing the right thing. Conversely, the flip side of that sword is I'm also going after those guys that are ruining it for the good doctors.
The other part of the problem is the illegal side of access through the dark web and drug smuggling.
Because we are seeing a lot of pills come in that are ordered over the dark web.
Since law enforcement began carrying naloxone kits, education has spread. The kits are now given to opioid users and even their family members and friends. A new problem, however, among teens is called Skittle parties.
Throwing them into a bowl, mixing them up, and then everybody takes a handful. They don't know what they're taking.
Those with substance abuse problems either end up in the hospital or in jail, neither of which are always the right places for treatment.
And how do we get a person from revival into intervention, treatment, recovery, and maintenance in a supportive community safety net?
An estimated 75% of the people being booked inside the jail are there as a result of some sort of substance abuse issue, which is costly to the county.
Our booking cost is estimated to be about $50 per person, and a housing cost is about $70 per day. If we just look at the detox portion of that, you can see the math there on the slide.
Most have dual substance abuse problems and require some sort of detox.
As we can see, the information we've collected, 52% are to opioid use. That's their drug of choice. They've declared this.
The county would like to see people get the treatment they need to reduce recidivism in the correction system.
Approximately 60% of the county's total general fund budget, running about $30 million in that general fund. 60% of that is for law enforcement related expenses, and over 2/3 of that is directly tied into incarceration and running the jail.
While drug courts work hard to keep reoccurrences down, it's not always easy due to the environment the abusers go back to. Many are picked up from jail or the hospital by their drug dealers and slip right back into their old habits. A peer support network is looking to provide help when there is a crisis through intervention or better placement.
A lot of them get out of the hospital, which right now we're trying to figure out what roadblocks we're having at getting into the emergency room to be there as a peer support when there's an opioid crisis. So really we can be that crisis intervention piece.
The state director encouraged the community to reach out and take advantage of USDA grants to help with opiate-related issues.
So we're working with communities so that they can address those specific needs.
But with some addicts also suffering from mental health issues, there's not enough help from trained clinicians or psychiatrists to go around.
We have wonderful therapists and counselors. We have no prescribing person who has expert training like I do in psychiatry.
Available and affordable housing is also a hurdle for those trying to recover.
The housing is the hub for a lot of this piece to allow people to get to where they need to go. So they can have access to where they need to go.
Now, I know that nobody wants a treatment center or a sober living or transitional housing in their area, but that's the only place that we can put it because they're within walking distance to a treatment center.
Another issue is transportation, but despite access to opioids going down, other drugs like heroin and fentanyl are going up.
Because in my opinion, along with benzos, that is probably the next biggest threat that we see on the horizon.
Besser suggested that Americans need to treat pain differently, like in foreign countries, by changing their mindsets.
We have an insatiable appetite for drugs in this culture. That's just a fact. And the sad thing is that is translated into the way we treat with medicine. I propose to you that we need to start looking at other venues.
In the meantime, many healthcare providers are using medication-assisted treatment or a MAT program,
which is actually the use of other medicines as a maintenance drug to allow a person to manage.
The group of leaders left knowing that if each person in the community does their part, it will help alleviate more problems in the future.
Having a discussion with your family about opioids, using them as prescribed in a safe manner, knowing that if we don't, they can become very dangerous. So disposal of prescription opioids. If we have them in our medicine cabinets and we're not using them as prescribed, we're done with our treatment plan, they need to be disposed of properly.
In Washington County, Melissa Anderson, Community Education News.